Acha, okay. So thank you very much. So I think there are many new people joined for this meeting. So just shall we introduce? Suppose if you are new to MOCAP, I think there are many new people to MOCAP. If you are new, please put. Thank you very much. Please put. So, I think there are. Please put in others. We can say just your name and place from where you are joined. If you are new to MOCAP, if you are joining MOCAP for the first time training, you can put N. N means new. Okay. So there are many new people who have joined MOCAP for the first time for the training. Thank you very much. So case history taking. It is actually one of the very important aspect. Actually, maybe very important for the students. It may be very important for the students who are doing their UG or PG. They will have to write the case history. So mostly when people write this case history, they get doubts. One is the format to be used. The second aspect, what are the aspects it has to contain? Most of the time, when people write the case history, it consists of just what do you call it? The information about the client. Only those things will be there in the case history, but that is not case history. So once what happened, I asked some college students who were coming for internship. I asked them, okay, can you show any of the case history which you have, which you people have done? Can you show it? Then they have shown me some case history, which is actually nothing but when a client comes inside the clinic, the name, age, only these aspects are available, and that is not case history. That even a UKG student will do. Isn't it? Taking the name, age, okay, and all these aspects. That even a UKG first and second standard children will be able to take it. Case history is something which is very in-depth aspect. Okay. So today we will discuss about the various parts of the case history, various parts, and also we will try to write a case history. So here our purpose is to write a case history. So if you are from college, definitely you will be doing it. So so that actually I told please come with a paper and then only it will be useful. So if any one of you here, okay, if you are just joined for listen and it is not going to be useful for you, okay, then you can watch it in the YouTube. That's enough, because there are many students, they are waiting outside, they are not able to join. Actually, this case history, it is mainly for students who are going to write the case history to be submitted to the college or university. For others also, maybe writing case history is very nice because it may be helpful for you also. Even whenever a client comes, okay, suppose if you maintain a case history. It may be useful for you in the future, and it may be useful for you when you conduct a training programs. Suppose every psychologist, every counselor, they conduct internship, etc. So for every case, suppose if you are creating a case history, then what will happen is when students come now, you will be able to tell them the various aspects. Okay. So please put it in the chat box. Okay. What are the parts of a case history? I have opened the mic. You can talk also. What are the parts of case history? And actually, what is case history? Yeah. Let this be interactive.
Sir, actually, we are taking the case history to know the all perspective of the patient, that how they are impacted and how we will how we will implement the prescription. I mean the therapies, etc.
Very nice. Very nice. So this is what.
So shall I try? Shall I try?
Yeah. Please.
Good evening, sir. Actually, in case history, what is the present complaint for which the client has come? What is the other problems, but all other problems are associated with the present complaints, along with identification data of the patient, is case history.
Further, other than that?
Other than that, plan of the treatment, plan of our therapies will be based on the complaints. So case history minutely of the problems.
Problems and what is suggested, how we can attend to the problem.
Yes.
The case history, whether it is written after completing the case or during the therapy session.
Yes.
Case history, whether it is written after completion of the issue, or suppose a client comes after the session is over, your case history is written, or when you are doing the therapy itself, it is written.
Before starting the therapy, we need to write case history, sir. Then we can start the session.
Yeah. Anything else?
From my side.
Yeah. Anything else?
So as far as I learn, we should not while talking to the client. It may be a distraction for them while it's like cutting their flow. So we have to listen to them carefully and we have to put it on paper, this whole thing after the session, as far as I have learned.
Anything else? Steve?
Sir, it is before the session, I suppose.
Before, that is, see, before
Yeah.
the session, we may not
You have to write down the details of the patients, exactly what is the requirement of the patient first. We can note it because as a human being, according to me, we can't keep everything in our mind. Only after going through it, we may write it in points. We may try it in points and then we can
Yeah, Nandita, the voice is having some problem, Nandita. Yeah.
Now it is okay, sir?
Yeah. Okay, begins with before the session, then continue with completion. Please mute your calls. So, हम हिंदी में भी थोड़ा बहुत बताएंगे, but it is we are having participants from international area, so we will not be completely concentrate on Hindi. जब प्रोग्राम जब एंड होता है, मैं 10 मिनट हिंदी में भी बता देता हूँ, ठीक है जी? Okay. Now, what is the meaning of history then? History, whether it is past, history is past or present or future. The word history.
Past.
Sir, it can be past, but for future also we note down certain things.
Past.
Because if I have to diagnose something, I have to write it for future also, that this can be done and this cannot be done.
Very nice, very nice. So actually, case history, when a client comes, one aspect is the data of the client. Even when you go to your doctor, your doctor collects the information, the various information they collect. All the information now that is fed in the computer. The moment you go now, they will feed it in the computer. They will feed it in the computer, the name, the age, sex, okay, prior medical condition. What are the prior medical condition? Are you suffering from all these aspects? They will ask few questions, okay. All these things are fed into the computer nowadays. Now, this is actually a demographic data, a data about the client. Okay, this we will be taking when the client comes, because when the client comes only we will be knowing his name. Before the client comes, how we will know the name? So the moment he reports, we will be taking the personal detail of the client. The difference between the counseling session and medical aspect, it little bit varies. Little bit varies. Little bit varies as far as taking the information is concerned. Taking the information from the client is concerned. A medical report. Suppose you are going to a medical doctor. For example, for eye problem you are going. They are taking some details. Okay. For that, and somebody comes for counseling. The report, which we initially we write the name, etc., and all other aspects. What is the difference? What are the things which is available in the counseling report, which a doctor may not be concerned about? When you go to a doctor for physical problem, he may not be asking certain details, which we may be asking in the counseling when a person comes for counseling. What are those details?
Family background and educational background of their parents.
Yeah, these are the thing. Even medical also they may ask what is your qualification, whether you are UG or PG. Okay, somewhere it is asked.
The parents' qualification,
Yeah,
their socio-economic status, and parent background which they are coming from, the environment.
super, super. One aspect is mostly
So
the
I feel like
doctors. Yes.
so counseling is something where you will be seeing the history of the patient. I mean to say their forefathers and all any kind of issues they are also having in the past or something, and based on that also they will give the counseling to the right person, to the patient probably.
Yeah, yeah. So we will use a term called client. Okay, patient.
Client, okay, done.
Isn't it a little bit? Uh, so what
I
Mridula ma'am
understand.
said, what Mridula ma'am said is 100% correct. The one difference is when you go for a physical problem, tangible aspects will be spoken. Tangible aspects. But in counseling, okay, intangible things are also recorded. Intangible aspects. See, certain things it is visible. Only those things a physical doctor will be concerned. But in counseling, we will be concerned about the things which you cannot see. Which you cannot see, that also we may be registering. So one by one, we will see what are the aspects which we will be seeing. All those aspects we will see. I'm just sharing the presentation. 1 minute. And what we will do is we will try to note down all these aspects. Okay. And I will tell the things with relation to a actual case history. Even today, I had one counsel. I will not be mentioning the name and all. Okay. So based on that, I will interpret it and I will tell. Okay. Even here also it is we have written patient, but I would like to change it as a client. Yeah. Can anyone read this? Whatever is wherever interpretation to be given, I will give it. Can anyone read it?
Yes, sir. May I?
Yeah, please go ahead.
A record of Okay, a record of information
A
relating to a
record.
person's psychology and
Ma'am, your voice is not
okay,
reaching
somebody
very
is there.
clearly, ma'am. Yeah, ma'am, the voice is not
Okay,
very clear, ma'am. Mohammed sir, you
uh,
can go ahead. Mohammed,
Yes, sir.
yeah, please
May
go
I?
ahead. Please go ahead. Yeah,
Uh,
I think the
case
network
history.
problem is there for madam. Yeah.
Okay, sir.
no problem,
A
no
record
problem.
of information relating to a person's psychological or medical condition used as an aid to diagnosis and treatment. A case history usually contains test results, interviews, professional evaluations, and professional evaluation and sociological, occupational, and educational data, also called patient history.
Patient history, actually in psychiatric language. Suppose someone goes to a psychiatrist, usually it is called a patient history. But when it comes to counseling, a psychologist, okay, we can call it as a client history because mostly we may not be, a psychologist may not be dealing with a patient. A patient will be dealt with the doctor. Yeah. So how to write a psychology question? So the various aspects of a case study, case history maybe. The first one is introduction, history of presenting complaint, past psychiatric history or psychological history, past medical history, family history, personal history, mental state examination. This is very, very important. Physical examination, summary and diagnosis, formulation and management. Here, formulation means a case formulation. Now, let me tell you with what has happened. Today, I had one client. Okay, so the client is doing second year. He is doing second year. So now the introduction. The introduction part usually it is to gather information to create a profile for the subject. Yeah. Can anyone just read?
May I, sir?
Yeah. Please go ahead.
Official or government records. This includes employment history, academic history, and medical records. Number second, personal items. This includes a subject's diary, photographs, personal notes to themselves, whereas and official clinical notes or reports. Number third, interviews. This includes speaking to the subject directly and also their friends, family, co-workers, professors, neighbors, and employers. Number four, observations. This includes observing the subject as they perform daily routines.
Maybe certain clients, certain things may not be applicable. All the things will not be applicable to all the clients. Certain things will be applicable to certain clients. For example, official or government records. This includes employment history, academic history, and medical records. For example, suppose if you are getting a client, uh, if you are getting a client who is working in government department, okay, and he is having he has developed some issues, okay, maybe anxiety or depression, any aspect. He is working in employment, and suppose, for example, if he tries to commit suicide. Now, to understand the background of the individual, sometimes we may require his employment history. Okay. For example, suppose a person who joined for employment only 6 months back. Okay. Someone who joined 20 years back. There is a difference. Right? There is a difference. Somebody who joined 6 months back. Now, suppose if he is getting a suicidal tendencies, the reason may be with the place wherein he is employed also, maybe. Wherever required, the things may be required. In all the cases, it may not be required. For example, today I dealt with a boy, actually who has completed his 12th standard, and he is going to his first year. Okay, the college is not installed. The online, please mute your calls. The online classes are going. Okay, but physical classes have not yet started. So in this case, employment history is not required, but academic history. Academic history is required and medical records is required. Why? Now, when they came, what they told is the parent, and one uncle and a boy. They came. So the problem of the boy is actually he was involved in gambling. He was involved in gambling. See, he is in first year. Okay, so far he has lost around 8 lakhs in gambling. 8 lakhs. Even immediately after completing his 12th, actually he used to handle the money, family money pertaining to father and mother, all the accounts, it was with him. Around 8 lakhs he has lost it. Team, please don't write all these aspects. Okay. So in this case, actually his employment may not be required. But the problem has started. He is involved in gambling online. During the course, the parents are shouted at the boy. Once he has ran out of the home, he ran, and 2 days he didn't come back. Then they found him. Then again the same thing happened. He sold the jewels of the mother. He sold the jewels of the mother and again started gambling. Again there was a fight in the home, and father and mother again they shouted. Even the headmaster shouted, and again he tried to ran away. And there were some whether to threaten or actually the suicidal ideation was there, maybe or may not be, but he tried. Now this is what has happened. Now here the medical history is very, very important. Whether before coming to me, whether they have gone to any psychologist, whether they have gone to any psychiatrist. This medical report is very, very important, because suppose if they have not gone to a psychiatrist, it is my duty to first refer them to a psychiatrist, isn't it? The boy is having suicidal ideation. He has ran from home twice. So even in the beginning itself, when we have the medical records, one is it may be helpful for the preparation of the case history. The second one, as and when, immediately what is the next action to be taken. Sometimes we may not be the proper person to give empowering to the person. In that case, we have to send them to a medical diagnosis. Where and all the medical records will be useful, may be required. Yes, Steve. Where and all medical records, because a client is coming, so immediately we may be starting creating the history, as Mrudula ma'am told very correctly. In what are the other areas, medical records is very, very important.
In forensic cases, sir, for forensic medical legal purposes.
Okay, exactly. Suppose a client is coming and he is telling some symptoms. What are the symptoms when they tell? We may require medical records. We may be asking medical records. Suppose, for example, a boy is coming, sir, in maths, my son is not getting good marks. In that case, medical record doesn't have any requirement. But there are certain symptoms when the client says, okay, suppose, for example, somebody comes and says, sir, I'm not having a people management skills. I'm not able to extract work from my employees. I feel very low. Maybe or may not be the medical record records may or may not required in some of the cases. But in some cases, medical records must. What are the symptoms when the client tells? We may be asking the medical record, or we may be suggesting them to go and see the doctor and then come back with the result of the doctor. Come back again with the findings and the advice of the doctor. What are the symptoms? suicidal symptoms, chronic anxiety, yes, insomnia.
Frequent headaches.
Episodes in depressive also,
Yeah,
schizophrenia.
yeah, okay. Anything else? Schizophrenia and all.
Headaches. Frequent headaches.
Very, very nice.
Heart
Manish.
palpitation.
Very nice, very nice. Beautiful, Manish.
Loss of appetite.
Loss of appetite, very nice, very nice. Loss of appetite, frequent headache. Suppose a woman comes. A woman comes. A woman comes. What are, suppose if the woman tells, okay, I am having a mood swing. I am nowadays I'm
Hot flushes. As for mood swings, hot flushes.
Yeah. So if these are the cases, medical records very much. Even if they are not having, recently I had one woman. She came and told that, sir, I am normal. Absolutely, most of the time I am normal. But suddenly I yell at my children. Suddenly I yell at my children. Suddenly I yell at my husband. After some time, I myself thinking why that I am yelling at my husband. He is talking only sense. He is not talking something irrelevant. What he says seems to be correct. Sometimes he may be talking with facts and figures, but I will not be listening. I will be shouting at them. So these are the things that happens for the last 6 or 7 months. Before that, actually, our life was very normal. They are having 2 children. One boy was studying in 9th standard. The other child was studying in 6th standard. Our life is going very nice. For the last 6 months, this has happened. And we thought, okay, let us go and meet a counselor. Okay. In this case, okay, they have not gone to, I asked them, okay, have you gone to any doctor? Previously, where and all you went? They told, we didn't go anywhere, sir, because it related to the behavior. We thought we will directly go to the counselor. We will directly go for counseling. But in this case, medical intervention is also required. Why? She is 34 years old.
Maybe some hormonal issues, sir.
Hormonal issues. What are the problems? What are the issues due to which a hormonal issue may come?
Menopause.
Menstrual problems.
34 menopause may not be there.
Menstrual issues.
Pre-menopause effect can be there.
Pre-menopause, 34 years if it is a family things, but 34, above 40, maybe menopause, particularly in this case.
Yes, sir.
Pre-menopause, that is one aspect.
No, sir. No, sir. Menopause has started with at an early age because menstrual cycle has started at the age of 10. So menstrual
Family
menopause has
circumstances.
started at
That's what. It depends upon
So-
family history. Suppose if the mother, if she got the that menopause at a particular age, maybe the daughter also may follow. But here, 34 years old, okay, maybe one of the reasons. Other than that,
Maybe ulcer. Ulcer, sir.
yeah, Priya, can you be a little bit clear?
Ulcer, sir. Ulcer.
Ulcer, okay, then very important aspect.
PCOD or something.
Yeah, Manushi. Yeah, Manushi.
Yes, sir. PCOD issue, sir.
PCOD, that is one of the important aspects. PCOD will create many things, many aspects related to the behavior. PCOD, what are the aspects of PCOD? Can anyone tell? What are the symptoms of PCOD?
Hair loss. Weight gain.
The hair loss.
no, sir.
Yes, sir.
PCOD has hair gain also. Hairy body,
Okay, then
hairy body, loss
weight
of
gain.
mood swings, weight gain,
okay,
Irregular menstrual cycle.
Swelling on body.
irregular.
Swelling on
Headache
body.
also, sir.
Dry and
Thyroid.
acne skin.
yes,
Mood swings.
mood swings. Mood swings will be there, isn't it? Mood swings will be there, and most of the people, the mood swings, they may be thinking that it is because of I have to go for counsel. They may not think that it may be because of this PCOD. people may not know. I have dealt a few cases, okay. Even through phone, first I used to tell that first go to a gynecologist and check for PCOD. And one more problem. It comes to men also, not only for women, men also. One more problem which may behavioral problems, okay, because of the physical issue. One more aspect. What is that? The first word start with T. T.
Thyroid, sir. Thyroid.
Thyroid. Very nice. Thyroid, if somebody is having thyroid, that will definitely create some kind of behavioral issues.
Mood swings also.
Yeah, mood swing. Mood swing will be there if somebody is suffering from thyroid. So case history means when somebody is coming, if they have the medical records, we can see whether they are having thyroid, whether PCOD problems. Earlier they were having PCOD troubles. Okay. Suppose someone has recently removed the uterus. The medical record is someone has removed the uterus. What are the general complications that may come for which they may come to a counselor? They have removed uterus after 6 months. What may be there? Maybe. These are things definitely it will not happen. Some of the aspects it will happen.
Sir, anxiety, depression, etc. Sir.
Anxiety, depression, because
Due to their weight gain, sir.
Insecurity.
for a woman, there may be people would have told that okay, when you remove the uterus, the hormones problems may be there, and you will lose your beauty. You will lose all your beauty. Your hair loss will be there. Okay, you will become black. These are the things. People passing the information without facts and figures. People may get. That is one thing. The second aspect is it may create physical intimacy issues with husband and wife. A case in which your wife told, nowadays my husband is not at all hugging. He's not at all hugging, and he is not taking care of me. This is the problem with which they came. My husband is not taking care of me. My husband is nowadays he is not hugging me. He is not kissing me. And in those days he used to when he goes to office, he used to hug me and go. Nowadays he is not doing any of these aspects. That is what the assumption of the wife. Okay, assumption and a little bit fact also was there. Now, actually, when we went into the medical records, actually she has undergone uterus removal because of fibroid. She was having fibroid problem. Uterus was removed. After uterus removal, the husband has got a reduced interest in physical intimacy. He started. Actually, the wife is not. The problem is not with the wife. The husband has developed such a certain aspects. This started having some expectations will be there with the woman. So medical records, it plays a very, very important role. 1 minute, I will open the. So medical history, it plays a very, very important role. So gathering, is it visible? Is it visible?
Yes, sir.
Visible.
Yes, sir. Yes.
Yes.
Yes, sir.
So gather information about the subject. Okay. So certain times if they are students, we may be requiring the academic history. For example, today that boy I asked him what is the academic history. What is the mark he took in 12th standard? What is the mark he took in 10th standard? Now he is in first year. Okay. What is the mark he took? And medical records they have not got. Then I have referred them. Then personal items. This includes subject's diary, photographs, personal notes to themselves, and official clinical or reports if they have. So in those days it is a subject's diary. Nowadays it is particularly mobile phones. We may be perfectly, maybe many of the time, 99% we may be interested in their behavior in their mobile and what do you call in TV. Interviews, this we may be talking with the parent, we may be talking with the other person. For example, today when before they came, actually the uncle spoke with me for around 30 minutes. What are the aspects, different aspects which is happening in home? All the aspects he told, which has given me a very good information. The boy ran from home after the mother and father scolded. Particularly, they have used the word, you should have not born to us. You should have not born to us. Why you have born to us? Like this, words which is very hurting, which they told in the mother tongue. When you communicate, see, when I'm telling in English, it is not having that much of effect. मुझे क्यों तुम पैदा हुआ? तुम पैदा होने से ना पैदा होना अच्छा है. If you have not born to us, that is very nice. These kind of words, the parents have used. Parents were continuously they were using. This was also the cause of certain aspects. Not only losing money. Losing money, that is one thing. That is from the boy's angle. But the boy may be thinking that, okay, I played again and again, so that I thought that I can recover the money. That was his thinking. When parents started scolding like this, he thought that he started getting the negative aspects. So these all are the talking with the nearby people or their parents or their friends. And those things, it has to be noted in the case history. Then only, even tomorrow, if you are going to discuss it with someone else, always in case history, we will not be using the same name. Suppose if I am doing therapy to Shivakumar, when I am writing the case history, I will not be using the real name, I will be using some other name. So for example, I am doing it for Shivakumar, means I may be putting it Raghu. I may not be using the same name. And even the people with whom we are talking and taking the various aspects, those things we will be writing not the actual names we may be writing, we may be writing the other names. So then observation, our own observation during when he comes to the clinic, when we see him, and even the test which we may be doing. So I will. So these are the aspects, very important aspects which we may be collecting: age, gender, employment status, health status, family members, relationship status, family health history, drug and alcohol history, challenges in life, life goals, coping skills, strengths and weakness. This is actually very, very important. Usually, when we do counseling, suppose if there are two counselors, always it may be, sometimes it may be best. We may be forgetting some aspects when we are collecting the information. We may, because we are also human beings. If we are doing it through a computer, it will have everything, it will write everything. So we may be collecting it. So today I have collected all the information, but I missed one aspect, the strength of the individual. So actually, one psychologist also was with me. So the psychologist immediately she asked us, "What are the strength of your son?" Because they were going on talking about his losing the money, gambling, and all these aspects. But the strength, what is the strength of the boy? The strength of the boy has to be written in the case history. Why? What is the reason?
To motivate himself.
Yeah, Sumita.
To motivate the client.
Okay. Motivate the client. There is a particular technical word for it. A technical word.
Empowering, sir.
Something more?
So to set the goals, long-term and short-term goals are set by strengths, like we can gather the information.
Actually, in counseling and psychotherapy, we use a word called protective factors. The technical word is protective factors. We have to try to understand what are the protective factors. See, he's having some problem. If at all I want to help him out, I have to understand what are the protective factors he is having. The protective factors are the positive habits, okay, his strengths, and the various aspects will be the protective factors. For example, this boy, he ran away from home because the mother told that particular language. Okay. So the protective factor here is the mother. The mother is also a protective factor because the boy loves the mother. Because he loves the mother, when mother told something, he developed that particular aspect to run away from the home. He ran away from home, but he came back at 11 o'clock. He came back at 11 o'clock and he saw his mother was inside and she was sitting. She was sitting and talking. He has seen it. Then he has gone. He has gone out and he was waiting at some other place at around night 1 o'clock. Then 1 o'clock they have seen him and they have brought him home. So during the aspects, the moment he came home, he just hugged the mother and started crying. Protective factor. The strength, when we talk about strength, objective strength and subjective strength, both the aspects we have to find out. What is objective strength and what is subjective strength? What is objective and what is subjective? What is objective and what is subjective?
Subjective is when we have somebody as our strength, like mother, husband, father. And objective is our nature, like a brave nature, straightforward.
Anyone else? What is objective?
Objective is something that can be measured, and subjective is something that cannot be measured, like it's subjective.
Sir, I think, hello.
Sir,
subjective. Sir, subjective relates to your inner self, and objective is relating to the outer factors that are influencing you. So subjective is something like your own feelings, and objective is the outer factors like maybe your surroundings, your environment, your weather that is affecting you. Thank you.
Very nice, very nice. Mohammed,
Sir, objective is the data, and the subjective is the relationship, feeling, and all this stuff.
Super,
So related to something, yeah, related to someone. Yeah.
Whatever can be seen, whatever can be seen, whatever can be measured, whatever is tangible, whatever you can see it, whatever tangible, whatever you are able to compare, whatever you are able to measure, that is objective. Whatever you cannot compare, whatever you cannot measure, whatever is not tangible, whatever is that is not tangible, all those aspects related to the subjective. So strength and weakness, we have to identify both objective and subjective. Most of the places what will happen is we may miss out the objective strength. Objective strength. The objective strength may be a protective factor. Suppose, for example, you are giving we are giving counseling to a student. Okay, we are giving counseling to a student. The student got a low mark. The student got low mark, and the teacher shouted, and he is not going to school. He is not going to school. He says, "I will not go to that school." The parents say that, okay, go to that school, yeah, no problem. Suppose I may be changing you to some other school. There also the teacher will shout, how many schools I can change? Okay. In this case, what may be the protective factor? Strength and weakness, subjective and objective. Subjective strength and objective strength. What can be? And yes, hypothetical aspects I am asking. What can be the subjective strengths? What may be the objective strength, which may be helpful for us? See, case history we are writing not for what do you call, not for just for the sake of writing. It is a document. It is a document which is helpful in our counseling sessions, present and future. So that should contain, always it should contain the reliable data. Reliable data. The data, whatever we are writing in the case history, it should be reliable, and it should have some kind of validity. In this particular case, what may be the objective strength, what may be the objective weakness. The objective weakness for which he is being, the teacher shouted at him, objective weakness. Then how we can, what are the aspects, maybe his objective strength, which we may try to find out. He got low mark in Tamil, the teacher shouted, and he says, I will not go to school. What may be the objective strength?
Maybe he could be good in other subjects.
Suppose he may be good in maths, no? He may be good in maths and science. That is objective strength. That will be helpful for the counselor, the psychologist, okay, to motivate the boy, because he is not going to school. To motivate him to the protective factor. Here the protective factor is the objective strength, that is, he is good in mathematics, isn't it? So these are the aspects has to be completely, we have to write it in the case history. So these all are the various aspects. I'll be forwarding, I'll be giving you the complete case history, okay, which contains all these aspects. Certain aspects I am just going. Can anyone read this?
Yes, sir.
Please go ahead. Yeah.
Include any emotional, physical, or sensory symptoms a subject may experience in order to develop a proper treatment. Thoughts, feelings, or concerns that relate to the symptoms and symptoms the subject is experiencing are also valuable to document in your study. If the subject undergoes any testing, describe all scores and assessments relevant to the case study.
Describe the subject's symptoms or problems. Now, in the case history, the first one is we will be collecting all these informations, all the informations. After collecting all this information, okay, we will be trying to understand the problem of the client, and what are the symptoms of it. It includes any emotional, physical, or sensory symptoms a subject may experience. Okay, a client may experience. Now, for example, the boy involved in gambling. A boy involved in gambling lost 8 lakh rupees. Okay. What may be? I'm asking a hypothetical question. Okay. What are the different emotional, physical, or sensory symptoms the subject might have experienced? See, he ran 2 times from the home. Okay. So the various aspects he would have experienced, emotional, physical, or sensory aspect he would have experienced. What are the aspects?
Guilt.
Guilt, superb. Guilt, the first one is guilt. See, when first he lost 2 lakhs rupees. Then he wanted to invest something more and recover that 2 lakhs. So for that, actually, he had to, he lost around 3.5 lakhs. 3.5 lakhs he has lost. Now the thing is, since parents are having, they are very rich people. Parents are very rich. The amount which is going from the bank, they were not able to track very clearly. Only after the accountant, the chartered accountant, when he brought it to their attention, they came to know that money is going to some particular websites it is going. Then only they found out. Now the problem is, what are the aspects he might have been, suppose, let us take the boy ran out of the womb. On that particular day, before he takes the decision to go out of the womb, okay, what may be the emotional, physical or sensory symptoms he might have experienced it?
They are not giving. He might have thought their parents are not giving the opportunity to get back his money.
Okay, very nice. One is guilt, that was very nicely told. Then Raj has told something very nice.
Frustration, sir. Frustration.
Frustration. The reason for frustration maybe. What may be the reason?
He'll not be able to understand the field called empathy.
Empathy. Okay, very nice. Then
Anxiety. Fear may be there. Fear may be there.
Yes.
He might have
Maybe-
thought parents are doing a traditional business, and he wanted to get back his money from the new way of for gambling and all this stuff.
Okay, very nice. Then one of the very important aspects, emotional aspect.
Emotionally hurt because his family was a bit harsh with him and they shouted at him. So emotionally, he's feeling bad.
So because of that moment, because of that, what is the feeling you would have got?
Confused. So feeling of rejection.
Feeling of rejection. Super. Feeling of rejection. I am not okay. The feeling of I am not okay. Transactional analysis. I am not okay and you are not okay. So even when he was talking with me today, okay, when I was talking with him, what are the symptoms? Now, when I am talking about the symptoms, see, today he has come, okay. See, these are the little bit things I am going in depth, okay. Maybe you are able to understand why I am going in depth. Today they came for the council, okay. 15 days before he ran, and twice he ran. In the last 1 month, twice he has run out of the home. Whether I should take the emotional, physical and sensory aspects now, because now he is in front of me. Now, whatever he is feeling, that I have to take, or I have to take from the past also.
Sir, you have to.
I have to take from the past or only now. What is that he feels now?
Sir, you have to empathize with him now. The only way he will understand, he will try to come closer to you. So you have to speak the language or the expectation, whatever he's got. And you have to try to empathy with him, and so that he will feel that.
Raj, my question is, I want to prepare the case history now. In the case history, I have to write the emotional, physical, and sensory aspects to tell you very clearly, emotional, physical, or sensory symptoms a subject may experience in order to develop a proper treatment. Here, the very important word is to develop a proper treatment. If at all I want to develop a proper treatment, only what he is experiencing now, that is sufficient to understand and to write it, or I should write the various symptoms which he was having in the past also, that has to be written.
Yes,
both.
you have to
write
about the past also, because past is very important.
Yes, you're right.
Meenakshi, please go ahead.
Because past experiences are very important. On the basis of that, what he is today, that is reflecting in his behavior. If he could have been modified his behavior at that time only, he would not have in such situation right today what he is in.
Yeah, Raj said very nicely, and everybody whoever said that is very much correct. Now, the simple aspect is the past emotional, physical, and other aspects. Okay. Why that I have to mention it?
As a
From the
protective
clinical point
factor.
of view. From the clinical point of view.
As a protective factor, sir.
Protective factor. Then why that I have to? Because when he comes to the counseling, some people will be very normal. When he is sitting in front of you, he may be very normal. Okay, but when he goes home, how he will be, we may not know. Because behavior may change. So the past aspects has to be taken, because relapse may happen. See, he has lost 8 lakhs. Nowadays, the parents have taken the mobile out of him. He is not using mobile, and they are also not permitting him to use the laptop and other aspects. Okay. Now, all these things have been withdrawn. Because of this, also he may be getting some problems, isn't it? The emotional, physical, and other aspects. When it is given, when he was involving, also there was something. All these aspects has to be mentioned. Then only we will be able to create a proper treatment. Otherwise, we may not be able to create the proper treatment. So thoughts, feelings, or concerns that relate to the symptoms the subject is experiencing are also valuable to document in the study. Then the important aspect is analyze the data and establish the diagnosis. This steps involves using the data from your research to analyze and select the appropriate diagnosis for the subject. For example, suppose we call it as suppose if I am doing it through CBT. If I am doing it through CBT, so suppose if you are implementing CBT, because that we have to write in the diagnosis and treatment. What is the treatment which is going to happen? What is the therapy which you are going to use? That has to be kept in mind. Even when we are analyzing this data and all, we have to keep it in mind. What is that I'm going to use it? Okay. Suppose, for example, if I plan to use CBT, there are some elements in the CBT which has to be followed, isn't it? So, what are the elements in the CBT? The case history. How in CBT, what is the terminology we use? Yeah, please open the mic. What is the terminology we use in CBT?
Behavior?
No. For case history, see, now analyze the data and creating a treatment plan. Okay. What is the terminology we will use it in CBT?
The irrationality.
Case conceptualization. Isn't it? Case conceptualization. A case conceptualization is having a different methodology. Now, when I am making the case history, when I am talking with the individual, the problem, etc., I should be having in mind what is the therapy which I am going to use. For that therapy, there are some intrinsic elements which is present. That also I should use it. I should follow it, isn't it? So this is actually in CBT we call it as case conceptualization. In case conceptualization, here what we will be doing is the step involves using the data from your research to analyze and select the appropriate diagnosis for the subject. For example, we come to conclusion that okay, this boy now he is having 2 problems. One is the social exclusion. That is, he is not talking with father, he is not talking with mother. So, select the appropriate diagnosis for the subject is what is the immediate problem that has to be attended, what is the long-term aspect that has to be attended, and how it is going to be, how I am going to treat it. To provide evidence to support your diagnosis, explain each step of your research methods and include the subject's symptoms Symptoms can also provide support and show how the subject meets the diagnostic criteria for a specific disorder. Suppose, for example, if you are working under a psychiatrist, maybe the DSM. For example, suppose if I am coming to the conclusion that someone is suffering from, suppose he is having panic attack. Now I should know what is panic attack, where that panic attack comes in DSM, what are the symptoms. Okay, all these aspects we should know, that has to be mentioned in the case history. Now we will discuss in depth about the actual case history also. Then we will be choosing a treatment approach. The next step in writing a psychology case study is to choose a treatment approach. Once you reach a diagnosis, here are 4 different approaches you may decide to use. One is cognitive behavioral approach, or humanistic, or psychoanalytic, or the pharmacological approaches a psychiatrist will do. Here the thing is, we will be describing the treatment goals and process. When we go, what is the treatment goal and what are the process which we are going to do? After identifying a treatment, this is what the problem. This is his problem. I have identified every aspects. I have understood the symptoms. I have understood the problem. I have stated the problem. After stating the problem, what is the treatment? And the treatment, for the treatment, what is the goal of the treatment? What is the goal of the treatment? So in case conceptualization, we may be writing all these aspects. So after identifying a treatment approach, define the goals of using this treatment, how you intend to use the treatment, and any outcomes you expect. Now your outcome is, suppose if you are using CBT, how the outcome is measured? How the outcome is measured? CBT. CBT outcome. Suppose I plan for this by, I plan to use a CBT means for a particular session, for the entire session, okay, outcome. How it is measured? What is the one aspect which we talk in CBT?
For behavior modification.
No, what is, I am asking how it is measured. We the measurable change, the outcome is measured through small. Every aspect. For example, today I am having a session. For that session, I will be having a smart aspect. Specific. This is the behavior which we are going to work out. This is a particular behavior. Specific, measurable. This behavior, at present, how many times it appears in a day? Now, what is the goal? What is the goal? What is the goal? And how we propose it? How we propose to reduce it?
Sir, this is my suggestion.
Yeah.
Measurable.
Yeah.
Previously, how many times you used website or the gaming application to run do the transactions?
Yes.
How it is reduced as on today? That's number one.
Yeah.
Number two, whether is a mobile phone or a laptop is got a postpaid connection or prepaid connection. Whether earlier how it was monitored and now how it is monitored. And what is the frequency of monitoring? Whether the amount is going, what is the transaction permitted? There is a permission is there. I can allow only for 1,000 rupees or 10,000 rupees or 1 lakh, something like this. We can set a permission for card or internet banking account. Can we set a permission? So these are the measurable things we can bring into the table. Thereby we'll be in a position to know how it is earlier, how it is now.
Yeah, whether our treatment is working. Now this outcome will come because of some behavioral intervention which you will be giving. As Aarti told, we will be giving a behavioral intervention. For example, I am asking the client to practice the thought record sheet. Suppose the seven aspect of thought record sheet, I am asking the client to write it. Every day write it. And I am using some methods of, for example, awareness. the moment you feel that you have to take the mobile and go to the particular website, come to awareness. How to come to awareness? The moment you feel, put a rubber band. The moment you feel, just take and release it. It will hit. The moment you hit, you come to your awareness. Okay. I have decided that I will not be using this particular website today. It comes to the awareness. Because mostly when we are not in awareness, the person may come in. So we may be having some, for behavior modification, we might be using some techniques. So we may be writing the techniques. What is the symptom? What is the technique which we have proposed? What is that the client should do? From which, what is the outcome we are expecting? So the outcome is specific, measurable, achievable, realistic, and time bound. So all these as an outcome. So we may be measuring the outcome. Some goals, how you intend to use the treatment and any outcomes you expect to occur after treatment. Some goals may include eliminating symptoms entirely or using the treatment to reduce some symptoms and implement coping strategies so the subject can return to a functional life. So these aspects we will be writing in the treatment goals and process. What is the treatment goals and what is the process? Treatment goal can be eliminating a symptom entirely or reduce some symptoms and implement coping strategies. Here, implement coping strategies. One is, if you see, eliminating symptoms entirely. That is a negative aspect which he is having, eliminating it. Reducing the symptoms. That is also the negative aspects, reducing it. Here, implementing coping strategies, that is pertaining to the positive aspect. The protective factors, using the protective factors to help the child or person for coping strategy. All these aspects has to be mentioned in the what you call in the case history. Then only it becomes a case history. So what we'll do, it's already 8:15. Okay, tomorrow we will see, and I will share with you a case history. Okay, I will share with you a case history. Just to go through it, whatever we have discussed, and read the case history. Try to what do you call? Try to just check what is that we have discussed, what is that available in the case history. Those things, check it, and tomorrow we will go through the rest of the sessions. Okay. Thank you very much, team. And
thank you, sir.
Is it something useful today?
Yeah. Yes,
Very
sir.
useful.
Puja
Very
time.
useful.
Puja
Thank you so
time.
much, ma'am.
Puja time. Puja time.
Very useful, sir.
Puja time. 97 people are here. Thank you very much. Thank you
Thank
very
you,
much.
sir. It's always a
Thank you,
pleasure
sir.
to be with you.
Thank you, sir.
Hope somehow some of the things I was able to give some kind of clarification. Okay. Thank you very much.
Thank you, sir.
Thank you, sir.